Hello everybody, I'm Amanda G, Psych MP, and welcome to the YouTube channel Mental Matters More, which previously was called Mental Health Matters. And I recently changed the name to Mental Matters More because I just feel like it's so appropriate when talking about subjects related to mental health. So today we're going to talk about some really interesting topics, so let's get into it. So as a psychiatric mental health nurse practitioner, I have a few different roles. One of them is prescribing medications, and the other one is performing therapy with clients. So today I wanted to talk about therapy and why it's important, what we use it for, different types of therapy. One of the major things that we use in mental health to identify triggers, develop coping skills, figure out why we have maladaptive behavior is to do different therapies with individuals. And most people have heard of cognitive behavioral therapy. It's kind of our number one all-around therapy that we use. And the way that I can describe that is it's kind of like that light bulb moment. And I think it's easier to identify when we talk about it in reference to someone else. And I'm sure that there's individuals that you know that you've thought, gosh, why does that person act that way? And then you get that missing puzzle piece. A friend of yours or a family member says, well, this is what happened, and that's why they probably act that way. And you're like, oh yeah, that makes total sense. So cognitive behavioral therapy essentially connects situations that happened in our past and behaviors that we have developed now that are usually maladaptive, that's why we're in therapy, and puts them together to kind of have that a light bulb moment where we can then develop more appropriate behaviors and situations. So when I'm assessing a client and developing a treatment plan with them, we're talking about medication management, we're talking about lab work, we're talking about diet and exercise, and then we talk about therapy in general. I really try to kind of get an overall sense of what we're dealing with, maybe the extent of their trauma or past experiences, and do some therapies based on that. Now, having said that, if I think that there is some major trauma or some significant event that has happened, I usually do refer out, and I like to give the explanation of, when you go to see your PCP, your primary care physician, they will do a general overview of what's been going on. But if they notice that a specific system is, needing more of a specialty, GI or your cardiac system, they're going to refer you to a specialist. And that's when I would refer to specific therapists or counselors or psychologists that is what they specialize in, is therapy, to really kind of give you the best therapy that's appropriate for whatever we're trying to target. One of the reasons why therapy is so cool is because it literally can change our brain and the pathways, and it's called neuroplasticity, and it means that our brain can change and develop new links and new connections to past behaviors, and kind of like take this situation and this behavior and, oh, okay, that's how they go together, and here's how we can form new behaviors, more appropriate behaviors that maybe will help us to have better relationships, will help us professionally, that will help us personally. Discussed cognitive behavioral therapy. Another really great therapy is exposure therapy. And this is the idea that you take baby steps, right? And this is with individuals that maybe have specific phobias, a fear of, arachnophobia, or a fear of crowded places, agoraphobia. And how we do the therapy for them is we slowly introduce them into those situations that would cause the phobia or the panic, and we desensitize. One of my absolute favorite therapies is called Dialectical Behavior Therapy, DBT. And this was developed by a psychologist who suffered from borderline personality disorder. It's essentially individuals who have extreme emotions. And the dialectical behavior therapy is not only used for borderline personality, but it's also used for generalized anxiety disorder, major depressive disorder, phobias, some other personality disorders, avoidant personality disorder. And it's been proven to reduce symptoms in as soon as 2 weeks. So once you start the therapy and start implementing it into your daily life. So we know when trying to figure out what medication is going to be appropriate, some of these medications can even take 2 to 4 to 6 to 8 weeks to work effectively. So the idea that we can learn a therapy and start that and see results so quickly is absolutely amazing. Another key fact about therapy is that it's not easy. Here to just ignore maybe our behaviors. But a lot of times, by the time you've come to a mental health professional, you're at a place where you can't ignore it anymore. And it's been so difficult and so problematic that we're having difficulty in all areas of our life. Emotionally, socially, financially, personally, our health is being affected. So, when you do start therapy with a professional, with a counselor, a licensed therapist, a psychiatric nurse practitioner, digging out those things that maybe have been suppressed or opening up that suitcase and unpacking it. So it can be difficult. In the end, therapy can help us to have better relationships with individuals, can help us get where we want to go professionally and personally, and is a great option for a lot of people. Couple different approaches when talking about therapy when I'm meeting with a client. First is the idea that let's try therapy before we try medication. And that's a personal decision you can discuss with your mental health professional. In some situations, therapy is going to be adequate in addressing those behavioral changes and those past events that we need to discuss and go through, and it's going to be very therapeutic and help, and you're not going to necessarily need medication. In other situations, individuals are going to require both medication management and therapy to really address their needs and to see best results for them. I also like to tell individuals when looking for a therapist or starting therapy, if you do not like your therapist or you feel that you don't have a good connection with them, find another therapist. I mean, I even recommend that with all healthcare professionals. If you don't like your healthcare professional, if you don't feel a connection, if you don't like your therapist, it's not going to work. It's not going to be as effective as it could be. So I tell people, if you don't feel that connection, if you don't have that trust, they won't take it personally. You can find somebody else that's going to work best for you. What's our topic today? Discussing therapy, which is a really important component in mental health and receiving care and treatment for basically all mental health disorders. Your background, your history, things that you want to address with your mental health professional is going to help best discover identify what therapy is going to work for you. Just remember, it's probably not going to be easy. You're going to be going through a lot of past events, but the idea is that on the other side, you're going to get improvement. So it does take time. This isn't something that you just have one session with somebody and all of our problems are solved. Usually there's multiple sessions that you can discuss with your professional. So therapy is going to be recommended. There's evidence that it helps, it works. It's a great option and an alternative for a lot of people. Well, thanks so much for tuning in today. Again, I'm Amanda G, Psych MP, which is called Mental Matters More, previously Mental Health Matters. And I changed it to Mental Matters More because I really, truly believe mental matters more than anything else. Where you are mentally is how you're going to be able to handle life, which comes at us from all different angles, good and bad. So where you are mentally is going to make a big difference. And I argue that it matters more than anything else. My goal is to make videos about mental wellness and promote talking about mental health issues, decreasing stigma. So if you have some topics that you'd like me to discuss, go ahead and put it in the comments below. Subscribe to my channel. I look forward to making more videos for you and hope to see you guys soon. Thanks.